Hello YouTube, this is Mark, and this is my 6-month update on my Achilles tendon rupture, which occurred December 10th, 2019. It was a full rupture with a 2 centimeter gap that I am recovering from non-operatively doing my own rehab. So it's been a month since my last update, 5 months. It's been a busy month. So my last update, I told you I was sore and tender. So I want to dive into that now. I am much better now, but there was a 2-week span where I think I just overdid, rehab and all the day-to-day life stuff, and I was really swollen, tender, and had a lot of pain. So, I didn't see my podiatrist or physician. It's just kind of a busy time in my life, and I'll get into that in a second. But what I think, so just my personal opinion. What happened is the Achilles, where the injury was, maybe swelled up a little bit, as well as the paratendon, which is kind of the covering of the Achilles. I think that swelled up quite a bit as well. And I think the biggest thing was the nerve that goes next to the Achilles. It kind of goes down the back of your leg and kind of goes over to the lateral or outside part of the Achilles, the sural nerve. That I think maybe got caught up in the inflammation or on some scar tissue, because I think even my 4 or 4.5 month video, I pointed to where I was having some pain there. That thing was on fire. Anytime I did a calf raise or anything, walking upstairs, I have like shooting pain, which really was, really scaring me, because I didn't know what was causing it, because I could still do all the motions, functionally, but I had this intense pain. So I didn't know what it was. Kept thinking, what is it? Is it differential diagnosis? Is it this? Is it this? Is it this? Is it just swelling? Is it scar tissue breaking down? And I didn't really know. But finally, after about 10 days of really not getting better, somewhere around that 5-month mark, I looked. I was like, maybe it's my sural nerve. And lo and behold, I started massaging and doing range of motion. So I kind of went, instead of massaging the Achilles up and down, I started massaging the sural nerve kind of away from the Achilles and up, maybe where it's supposed to track, where it comes across the Achilles and down to the lateral side. So once I started doing that kind of massage on the actual nerve itself and kind of getting it away, really just actually pushing the nerve away from where my pain was, where the Achilles was, and getting it away from all that inflammation, and also maybe desensitizing it a little bit by really rubbing on it pretty hard. 2 days later, it was like almost back to normal. So I'm pretty confident that was the problem. I do not know for sure, but based on what I did with the massage and also some range of motion exercises, that lateral nerve pain subsided like 90% within 2 days. And I was able to all of a sudden start my rehab again. So if that happens to anybody, that worked for me. So, I'm not sure if that's exactly the cause, or it could have been just timing. The coincidences do happen. But that certainly is what I think is the case for me. So I'll kind of show you on the Achilles, and then some of the motions. I did the range of motions to help stretch it out, so it kind of goes back into its natural groove. That helped me get through that painful period in my rehab. So get this down. So the sural nerve kind of goes down. You can almost feel it on me anyways, crosses over and goes down here. And that's all where I had the pain, was right here. And my wife, even when she would massage my Achilles, if she touched that nerve, just that, really just this big of a spot, not even an inch maybe, it was like lightning bolts went through me. I would shoot away from it. I'd rip my leg away as soon as she touched it, because it hurt so much. Now it's still there a teeny bit. I'd say maybe 5% at most, but I do some light stretching and a quick massage, and that's not noticeable at all unless I really look for it. So still kind of keeping an eye on it, of course. The range of motion exercise I did to relieve it was I'd start really digging into the Achilles on the outside and just kind of massage it into its groove and get it away from the inflammation, which was kind of right here. It kind of made it like a little golf ball or lacrosse ball. And then I just did this kind of toes pointed up and in, towards me, and really just kind of crank on my foot to kind of stretch it out. And within 2 days of doing that, just a few times, it was night and day difference as far as, oh my gosh, my foot works again. So went through that uncomfortable period. Took a little bit to figure out what was going on, but then I've been good since. But yeah, in this time period, it's been crazy. I had my third kid, so that's why the no 5.5 month update. My pharmacy was one of the ones destroyed in the unfortunate protests and looting over the horrific George Floyd incident. So a lot going on in the last month for me. So hope everyone's doing well and praying for everyone that needs the prayer out there. Hope the world kind of heals itself a little bit right now. And in the mood of healing, I'm still healing my Achilles. So not to be cheesy or make light of anything at all. But yeah, so the rehab's been going good. I can show you outside now some of like the running. I am running a lot more comfortably now. Even doing some light jumping, light hopping, single leg hopping, which is good explosive movement on the Achilles, not pushing it too hard, and overall feeling pretty good. Another thing I wanted to show too is this is something I've been doing probably all along, and I keep meaning to do it in a video, but I keep forgetting. And it's just kind of checking my angles on my Achilles, like the Achilles tendon resting angle. So this kind of tells you how your Achilles is healing based on its position when you just lay it at rest. So I'll do a couple and show you how it works and just how it should look. All right. So I'm gonna keep the knees in the same spot and just completely put the legs at rest. And I'll show you, this is my injured foot. And you see it rests at about the same angle as my healthy foot. Same thing up here. You see it points up a little bit, that this is pointing, this is at rest. Injured foot right here, healthy foot. So you see they hit the same angles. So to me that's important, that the Achilles is not hanging loose and lax. It's not flopping. That would be an indication of healing long. So I've been keeping an eye on that this whole process, and just wanted to show everyone little tests you can do to see how the recovery is going, how your Achilles looks. If you're looking at those things and the angles don't look quite to be the right angles or similar to the healthy foot, maybe something you want to go check your doctor out, depending on your goals, of course. If you're trying to be athletic again, which I still am, you'd want to probably maybe consider another kind of therapy, maybe even surgery, to get that angle shortened back again. So I'm going to bust out a couple heel lifts, kind of talk through how the Achilles looks and the calf looks. Definitely have some muscular redevelopment, like my left injured leg, like the outside of my leg, muscles and tendons that are bulking up as a compensation. Got some veins rippling through different parts of the leg that don't exist on my healthy leg. It's just kind of making up for what I lack in the Achilles and the calf strength. So I'll show you a couple of those things, and I'll kind of go outside and show you how I'm running and jogging right here on today is my 6th month from injury. So here's a couple things. See, this muscle goes through here. I don't know if it's like peroneal or the anatomy lesson. It's not really what I care about so much. But this right here is a lot thicker. You can kind of see it when I flex. It just feels so solid compared to my healthy leg, where it's thinner, still solid, but not really doing the work. This is doing the work. This is kind of a support, whereas this is taking on a lot more of the, taking the weight of the calf raises. So I'm doing a bit more work. So here's the calf. See the Achilles. Still. Here's the Achilles. So quite a bit thicker. Muscles are redeveloping. My calf raises are still good. And even you see like in my shins and like veins are just kind of compensating for what I lack on my natural, pre-injury leg. But all that matters to me is function, and I am functioning very well. Did a pretty difficult hike, about 5 miles the other day, and had to carry one of my kids about 1.5 miles of it. So good weighted hike with some hills, incline and decline. When I was doing hiking before, a lot of it I would do the inclines, especially I would kind of side foot it just to be safe. I now am doing a regular walk just with my foot straight, because I really want to get that dynamic and explosive stretch back from going uphill. So uphill is still one of the things I'm working on. I still haven't really started running uphill. Sorry, sun out here. But I still have, I've started to go uphill a little bit, and I'm hoping to really progress on that. So kind of show you my agility stuff that I'm casually doing, not every day, but pretty frequently. So high knees, butt kicks, and then this is the exciting one, some one-footed hops. And here's kind of a decent effort run. Just gonna go to I'll run to the play set. So a lot of the athletic stuff still has a ways to go, but progressing. 6 months from injury. Can't really remember anything else to say, so just want to give an update of where I'm at in 6 months post-rupture without surgery. Be well.